Welcome to the grand finale of the TecXposition 2020 Best of Africa Pitch Competition. So for those who are just joining, hopefully you are now in the right place. My name is Angela Mathon, and I am currently the Global Head of People Analytics at Aviva, and I'll be your host for today's pitch competition. Over the next hour, we are going to hear from our 5 finalists as they pitch their startups to our judges. Each judge will rate the competition against 8 criteria, and the contestant with the most amount of points will win first prize for a total of 3 prizes that will be awarded in today's event. But before we begin, I think it'd be nice if I hand over to the judges for a quick introduction. Judge number 1, Eloho, I hand over to you.
Okay, hi. My name is Eloho Omame. I'm the Managing Director of Endeavor in Nigeria. We are a global organization that works with high growth, high impact entrepreneurs at the scale up stage, which in entrepreneurial language means sort of Series A, Series B and on. We're in about 40 markets globally. I started the Nigeria business in 2018. We're currently supporting about 17 entrepreneurs, 10, 11 companies, that are typically at the frontiers of our ecosystem across a range of different sectors, including fintech, health tech, etc. So Paga, 54 Gene, Kobo 360, businesses like that are all within our Endeavor portfolio in Nigeria. Glad to be here and looking forward to it. Congratulations to all the participants for making it this year.
Thanks, Eloho. And now for our second judge, Stephen.
Thanks, Angela. And first, congratulations to the panelists or to the finalists, and good luck to you. I guess for the purpose of this, I would count myself as a serial entrepreneur. I started my first software company about 16, 17 years ago that we brought down to the Valley and grew that business out until I moved to the UK in 2007 and sold that business. Since then, I've been involved in a number of different projects. I got involved with an angel club out in the Southwest called the Surrey Angels. Spun out a few businesses, currently doing some work with Founders Factory around the business of financial ratings and impact. And I'm involved in a UK government program called the Global Entrepreneur Program that does a lot of work in Africa, which looks to work with aspiring IP-rich businesses that want to make the UK their base to go global. So looking forward to hearing the pitches, and good luck to everyone.
Thanks, Stephen. And now we're going to hear from Ash.
Hello, everyone. Congratulations to the finalists. My name's Ash Rust. I'm a pre-seed B2B investor based in San Francisco. I usually focus on coaching founders before I invest in them. My investment focus is also based in North America at present. Before I was an investor, I was a serial entrepreneur. I was very lucky to have a couple of wins at being an early employee at Clout back in 2012, 2013 area. And then me and some buddies from grad school started a company called SendHub, which we sold in 2015. Really looking forward to your pitches. Thanks,
Ash. And for our final judge, Tam.
Hi, everyone, and congrats to the finalists today. I'm a general partner at SeedStars Africa Ventures. So SeedStars is an accelerator focused on emerging markets. We have presence in 90 ecosystems around the world, 25 of which in sub-Saharan Africa. And beyond our accelerator fund, we're now deploying an early stage fund looking at pre-Series A and Series A rounds on the continent. Very happy to be here and eager to hear your pitches.
Excellent. Thank you to our judges. As you can all hear, we've got some pretty impressive judges, so you guys are in good hands. Now let's hear from our contestants. Our first contestant, number 1, Falake, if you can give us a quick introduction.
Sure. Hi, everyone. My name is Falake Owodunni. My company is called Emergency Response Africa, and I'm excited to tell you how we're changing the face of emergency medical services.
Thank you. Contestant number 2, Tope.
Hi, everyone. My name is Tope Sulaiman. I'm co-founder of Scrap-Based Technologies. Hi, everyone. Co-founder of Scrap-Based Technologies, and I'm happy to tell you that we are facilitating the collection of recyclable materials in Nigeria, and we're looking to expand to other developing nations. Thank you.
Excellent. Thank you, Tope. All the way from Tanzania, this is George.
Hi, everyone. This is George from Tanzania. I'm the co-founder for an organization called SmartCo Enterprise Limited. We are doing education technology. I'm looking forward to talk more about the education space in Africa.
Thanks, George. And now I'd like to hear from our contestant number 4, Mary.
Hi, everyone. This is Mary from Nigeria. And I'm here to let you know how we are changing the face of unemployment in Africa and how we are solving this problem. So I look forward to speaking with you all very soon.
Thanks, Mary. And for our final contestant, Victor.
Hi, everyone. My name is Victor Emai, and I lead within medical healthcare. I'm super excited to share with you how myself and my team are revolutionizing healthcare in Africa at large.
Excellent, excellent. Well, thank you. That was our contestants. Good luck, everyone, as we kick off the competition. So now I think we're going to hear our first contestant pitch their idea. So number 1, Flake, you're up.
Hey, I'm just going to share my screen. Okay. Can everyone see my screen?
Yes.
Fantastic. All right, so thank you very much for this opportunity. My name is Folake Owodunni, co-founder and CEO of Emergency Response Africa, and we're providing fast, safe, and affordable emergency medical services across Africa, and we're beginning in Nigeria. A few years ago, my son had a medical emergency. Fortunately, we were in Canada, so I simply called 911. Within a couple of minutes, he got help, and we didn't even need to go to hospital. And that got me thinking, if we were in Nigeria at the time, we would have probably had to go from hospital to hospital looking for help. And I know many people who have died in this situation. To give you some perspective, Canada has 1 ambulance for 11,000 people. But in Nigeria, 1 ambulance serves 191,000 people. And the few ambulances that exist are often poorly equipped and staffed and not connected to a central network. As a result, more than 200,000 people die every year from just 3 of the top causes of emergencies: road traffic accidents, heart disease, and birth complications. And across Africa, this number is in the millions. So let's change that. Emergency Response Africa, or ERA, combines training, technology, and transportation to deliver medical care to victims. We train individuals in the community to respond to emergencies and connect them to victims and hospitals using our intelligent dispatch and communication technology. We also partner to supply low-cost medical transportation, such as ambulance tricycles, and that creates an effective system. So here's how it works. A victim or bystander reaches out by phone, SMS, or mobile app. Our system analyzes the situation and dispatches the most appropriate responder based on location, training, and access to a vehicle. If advanced care is needed, our system recommends and alerts the most appropriate hospital, and the victim can be transported there. Once the victim has been handed over or discharged, our responder completes a report and moves on to the next emergency, and they're paid for their efforts. So current competitors offer expensive specialized care, yet still have average response times of about an hour. ERA, on the other hand, offers access to care that is fast and affordable. So we ensure that a trained responder is on the scene in under 10 minutes, giving the highest chance of survival. And by focusing on low-cost vehicles like the ambulance tricycles, we not only save time in traffic, we also cost up to 85% less per dispatch than a typical ambulance. And of course, because our network of responders is embedded in the community, our customers feel safe because help is literally around the corner. So our initial target market for this service is the 52 million Nigerians who earn a living wage but lack access to affordable care. Our proposed pricing, which is based on users' willingness to pay, can be paid through community organizations, can be paid through insurance, or directly by individuals and their families. Currently, nearly $2 billion is spent on emergency care across Africa each year, so the opportunity is huge. So to go to market, we will be launching our service in beta in the first part of next year. We'll start in one local government area within Lagos, and our goal is to respond to up to 1,000 emergencies over a 6-month period. The goal there is to also be able to get testimonials, aka social proof. Following that, we expect to raise a seed round of funding, which will enable us to scale across Lagos and move into 3 other states. And by 2025, we'll have our eyes set on an Africa expansion and grow from there. So far, we've built our technology application, which includes a first responder mobile app and the supporting control center applications. We ran a pilot in February of this year where we trained 30 responders to respond to 175 simulated emergencies. We learned a lot about response times, about the training model, but for us, what was most important is that the responders have continued to deal with real emergencies in their communities. And one of the pictures here is of Yemi, who was able to help a road accident victim on his own initiative. So every bit of funding that we get enables us to actually coordinate this response to save more lives. So far, we've registered up to 300 first responders, potential first responders in 19 different states across Nigeria. And we were recently awarded a $30,000 grant from the Japanese government to run our beta test in 2021. We have a number of partnerships with hospital, government, and other platforms to expand our reach. And so what we're looking for is another 30,000 to complete the funding gap that we have for our beta. And that would be put towards our staff, some marketing and administrative costs. In terms of our financials, we expect to be able to break even by 2024 and expand from there, generating up to $450,000 in profits thereafter. ERA was founded by Mame Poko and I. I have a background in public health. Mame is a software developer from Ghana, and our team and our advisory board are made up of individuals with expertise in emergency medicine, software development, and financial services. We are ERA, and we would like to treat every emergency with urgency. Thank you.
Excellent, excellent. Thank you, Falake, and such an important initiative. Now on to our next contestant, Tope. You're up.
Hi, everyone. So I'll just try to share my screen now.
Excellent, we can see it.
Hi, everyone. My name is Dr. Sulaiman. I'm co-founder of ScrapPace. So ScrapPace facilitates the recovery of recycled materials. In 2018, myself and my co-founder went out to see how exactly material recovery is done in the local market. And what we found out was interesting. We saw a lot of collectors on the street, and they are sponsored by middlemen. Today, waste generation is expected to grow to $3.4 billion by 2050. And this is brought about by rapid urbanization and growth in these places. Again, we're looking at a 70% high from 2016 levels, which is currently easing. So if I put this in context, our waste producers in developing nations generally cannot dispose of over 85% of the waste generated is not disposed of properly. Waste producers don't have an efficient way to dispose of their recyclable materials. And existing local compensation models is not self-propagating, which means it is only targeted towards the low-income earners, and other income earners are not involved in this recovery. So generally, technology seems to be totally missing in material recovery space, and that's what we're looking to do. So our solution is to facilitate the recovery by localizing collections for our producers and personalizing it for our waste disposals. Our platform allows for waste producers to dispose of their recyclable materials and get paid for disposal of their recyclable materials. You can either become a producer, a collector. A collector is typically someone who picks material on request, similar to what the Uber model does, and we have them around. While we can also become a host. A host is a person that gives us storage space that is temporary over a period of time. So let me take you through how it works. Meet Olaronke. Olaronke is a producer, Umar is a collector, and Mr. Ogunleye is a host. Olaronke has kept materials for over a period of time now, and she's finding it really, really frustrating because she cannot dispose of her recyclable materials. And the same thing applies to millions of other customers in Nigeria and developing nations. Olaronke got held of our USSD code. That was our USSD code. Then Umar, which is a collector, comes across to her, scales the material, and pays her compensation for this material. But for Umar, who is our collector, collecting the material is only one part of it. Disposal is another thing. So Mr. Ogunleye is paired with Umar, where Umar can then take the material to dispose properly, then we take it up from there. So Olorunke, our producer, because we know that the internet penetration rate and the category of persons is not as high as it is, so we're looking at USSD for our waste producers, which is currently active. We have a mobile application for our waste collectors. As you can see here, Umar is our mobile collector, mobile application, while Mr. Ogunleye uses our web application. So Mr. Ogunleye can see what every single waste producer is disposing of at every particular point in time, while on our own hand can see what the entire region is disposing of. We can calculate recovery rates and be sure that we avoid a lot of landfills. So over the past 9 active months that we've been operational, we've generated over $60,000 in revenue. We've collected over 153,000 kilograms of materials off the streets of Lagos. We, in a single month, we have about 1,700 customers registered, and we're growing at 57% month on month from the month of August. Our business model is simple. All of the materials that we are recovering is sold off directly to our network of manufacturers. Our platform does 3 simple things: make individuals to host collection outlets, collect materials, or request for pickup using our USSD. The growth model is very simple. What we're looking to do is to localize our collection outlets. The more closer we are to our producers, the faster we can reach them, and the faster we can cut disposal time. So we are localizing, which means that enables us to cut that. Commissions model is what we're looking to also implement going forward. With our growth rate in the next 24 to 36 months, we'll be transitioning to a commissions model such that we can sit back and provide traffic to all of the persons within our network. So enterprise sign-up is also a way we're also looking to implement going forward. The market opportunity is huge. The world recycling market is valued at $320 billion. But in Nigeria, it's valued at $1 billion. But something is interesting about the Nigerian market. It has the fastest growing rate of about 291.6% over the next 3 decades. And only Southeast Asia can compete in this growth rate, which means by 2050, the market size in Nigeria is going to be worth over $50 billion. So this is the best time for us to get in. Our competitive landscape is huge and is also vast because we have local competitors, and it is led by NAC. NAC has the most extensive network across the country. All we're doing differently is simple. One, we are localizing collection through our network, our host collection outlets, and our collection carts. We are the only one in the market right now that has the entire process from collection up until disposal that is technology driven, and there's overall compensation model for everybody within our network, all the businesses we have within our network. Myself, I'm Tokwa Sulaiman. I'm currently the co-founder and business development lead for ScrapPays. I've built supply chain business in over 3 African countries that run simultaneously. My co-founder, Bolu Atife, has implemented technology for top company in Nigeria and deployed this technology for top brands like KPMG, GSK, and the rest of them. Olumide is product development lead, while Ibrahim is with the Bank of Merrill Lynch and is currently our financial lead. So we're currently seeking to raise $220,000, pardon me, and we're looking to use this to get to 10 host locations and 12x our revenue within the next 18 months. Use of fund is for outlet setup, technology, cost of administration, cost of sales, and administration. The reason we're doing this is simple. Our goal is to drastically improve recovery rates in developing nations. Africa has about 4% recovery rates in comparison to other nations that have up to 50% recovery rates. We're building independent businesses, we're collecting materials, and we're avoiding landfills. Umar, our collector, before joining ScrapPays, used to walk long distances without knowing exactly where to get materials from. Now, Umar no longer does that. Umar picks material only on request. We automatically pair Umar with the producer and a drop-off point. He receives commission for every kilogram, and from us, he has gotten over 69 to 80% more than he usually got while walking in the streets. In the next 24 months, we can reach over 5,000 Umars in a single city, and we're looking to scale to other markets.
Excellent, excellent. Thank you so much for that, Tope.
Thank you very much.
Well done, great. Okay, now moving on to our third contestant, George.
So let me share my screen. I hope you can see it. Yeah. So hello everyone. My name is George Akimali. I'm the co-founder and the CEO of SmartCo Enterprise Limited. So at SmartCo, what we're trying to do, we just digitize the African education and by unleashing the power of technology and data. So why we decided to do this? In Africa right now, we have 260 million school-age children in sub-Saharan Africa. And these are the children who are located in primary schools, secondary schools, and also tertiary education. But the unfortunate thing that less than 20% of these students are actually leveraging the power of technology in learning. So that's why we created Kisomo. So this is the platform which unleashed the power of data and technology and allow digitization of universal education in sub-Saharan Africa. Our product works in 3 ways. So it helps students to have a fun and engaging learning experience, but also it helps teachers to monitor the students' progress and also earn some extra revenue. But in another way, it helps the government and other education stakeholders to make informed decisions on education. So we have been in operation for a couple of years, and so far we've managed to generate about 300,000 USD in terms of revenue, and we also managed to reach about 125,000 users across Tanzania and Kenya. But also we managed to work with almost 172 schools across East Africa. And apart from the traction on the users, but also we managed to work with different stakeholders and partners. We've been working with the largest university in the country, but also we've been working with the largest university for adult education in the country. But also we've been working with the largest telecommunication company in Tanzania, which is Vodacom. And also we've been working with other international accelerator programs, such as Good City Foundation and Abanks. So why we do this, and we think that this, as I said before, that we are having almost 260 million users who are potentially can be part of the Kisomo. And the African e-learning market is growing rapidly, and the sub-Saharan African market is expected to reach 1.8 billion by 2024. So what we do literally, our best value proposition is around technology, whereby we leverage modern technologies such as AI, virtual reality, and machine learning to provide the best learning experience for the students. But also we make sure that we provide these services at the lowest cost possible, because we understand that most of the African markets are coming from low-income families. And we also understand we are not alone in the market, but we position ourselves as a data-driven organization. But also we provide localized and personalized solutions compared to our competitors. And in order to make sure that we are remaining sustainable, we are generating revenues, as I said before. So most of our revenue are coming from subscription, whereby user can pay as an individual or as a school to subscribe to our platforms. But also we do selling of hardwares, which can allow offline access of our product because of the internet challenges in Africa. But also we do revenue shares, whereby we engage teachers and instructors to create content, and we split the revenue which is generated from that specific content. So this is a quick snapshot of our revenue, a background history of our revenue, but also our projected revenue. We are already making profits, and we are hoping to reach a $1 million revenue by 2022. Our team is composed of different individuals with different background and experience, both in professional ways, but also in terms of the work experience. I have a background in information communication technology. My co-founder is also having a background in financial and finance management, but also we have our CEO who is having 6 years of experience in managing operations, but also we're having Julius, who is also head of the marketing for our company. And our team has been winning a lot of awards in terms of recognition from the international and local organization. Recently, we won the African Business CEO Award as a top 50, but also we won the Expo Dubai 2020 and so many other. So right now we are raising an angel round of 250,000 USD in a convertible note, and 40% of this amount will be going straight to improving our universal content library, especially for science subjects. But also we are going to do the marketing for making sure that we add at least another 5,000 paying users. And also we're going to do research and development specifically to improve our technologies. And the funding we are raising specifically will allow us to build the stronger roots in the markets, but also will double our revenue within the next 12 months, and also help us to position for raising the next round of funding. So in summary, we are just SmartCo, and we are digitizing the African education system by unleashing the power of technology and data. And we are having a strong team. We have that much revenue, and we are talking about almost 1.8 billion market opportunity. Thank you very much. Back to you, Angela.
Thanks, George. Wow. So we've heard from 3 of our contestants. I'd like to take a minute now and sort of pause and check with the judges if you've got any questions that we would like to ask our contestants while we've got some time. And the 3 contestants that we've heard from are Falake of Emergency Response Africa, Tope from Scrap-Based Technology, and George from SmartCo Enterprise. So any questions for our first 3 contestants from the judges so far?
I have a question.
Sure.
So for Emergency Response Africa, how do you distribute to consumers?
So we have, I guess the best way to put it is more of a B2B2C model. One of the things that we're doing right now is engaging with communities. So in Nigeria, there are a lot of residential estates, which are run by associations that effectively collect fees for people that are living within those estates. And those fees are used to cover certain shared services. And so our goal is to reach through those estates to the individuals that live. An average size estate can have maybe between 150 and 300 households, and that gives us, you know, maybe like 4 or 5 people per household. That gives us access to almost 1,000 people per community.
Excellent, excellent. Thank you. Great question and great response. Any more questions for our first 3 contestants?
Yes,
So
maybe another question for you, Falake. So how are you able to cut down on the response time, right? I mean, you're not flying over the congestion in Lagos, are you?
Yeah, great question. So I think there are 3 things that are at work to help us achieve that. The first one is simply by having a network of first responders. These are individuals that are already in the community. So in an ideal world, if I have an emergency now, I'm not sending someone from across town to come and help me. I'm sending someone who's maybe 2 streets away. The second thing is we will have some of our responders on bikes, so motorcycles, and those are just fantastic for cutting through traffic. That's something that we have tested, and a 3-minute response time is actually achievable. And then the third thing is the technology. It's really about finding the fastest route to get there. And so by identifying the location of the person who's calling and providing that to the responder who's responding, they're able to navigate their way to the location as quickly as possible.
Cool, thanks.
Excellent, excellent. Thank you. Any more questions for our first 3 contestants?
I have one, and well, I have one. It's also for Emergency Response Africa. I have other questions, so I think we might just have a limit. I probably don't have enough time. So for emergency response, on your customers, can you speak a bit about, you alluded to it, in terms of customers who are earning a living wage and providing affordable services to them. But what is the profile of a customer that is able to, add that $40 a year on top of whatever they're already spending, and what do you think that means for the potential opportunity? And I guess let's start with Nigeria, because that's where you're launching.
Yeah, so what we did was we looked at the breakdown. Sorry, my daughter just strolled in, so if you hear baby sounds, I apologize. So we look at the we looked at the breakdown of income levels in Nigeria and basically analyzed that. So the range that we are looking at for our service starts from about $3,000 per year up to about 16,000, and we're looking to offer a tiered 3 different tiers of services to that group. And so that number there, that $40, is actually geared towards the $3,000 to about $7,000 range. And those are the individuals that we expect to be able to afford that price. Our goal is really to provide a service that's affordable to most people, but we know that to run a sustainable business, it's important that we start with those that are able to at least afford a certain level. And then over time, we expect to be able to partner with development finance institutions, which would allow us to then reach out to the lower income levels.
Excellent. Any more questions?
Yeah, I have one maybe for Kisomo. Can you maybe explain us same kind of question, like who's your target customer? I think you mentioned in the presentation that you're selling your service for like $99 a year, and you're targeting both individuals and schools. I'm not entirely sure what the model is here.
Yeah, so our currently target market is the parents of the students who are either in secondary schools or in high schools or in tertiary education. But we also work with the B2B2C model, whereby we sell to the schools and institutions, mostly the private ones, and these institutions provide these services to their end users. But ultimately, when we do that, the cost also goes back to the parents. So that's why our customer, like our main base of customer, we normally say are the parents, because even if we sell to the schools, they'll just bring back the cost to the customer, to the parents.
Excellent, excellent. Okay, we've got time for one more question for the first 3 contestants. Okay. All right, if there are no more questions, we will now go on to the next contestant. So contestant number 4.
Sorry, Angela, if we have time for one more question, I have another one for you. At Kisomo, so the content, so there's a significant part of the amount you're raising that is going towards developing your own content. Can you tell us more about that? Is it something that you're already doing today? And what kind of content do you provide, and what kind of content are you intending to provide with that funding?
Yeah, so the reason why we are doing development of our own content is that most of the African market, like, they don't have their own content. We have a lot of content which are coming from India and other Western countries, but this content have no relevance to some of the African markets. So that's why we're developing our own content. So as I said, like 40% of that amount we are raising is going to help to develop the content, but this content will be universal acceptable content, meaning that we can develop the content which can be used across almost African market. Specifically, for now, we are targeting the East African market, but we can scale the content and just replicate it a little bit to fit to other African market. And apart from that, we are also using user-generated content, whereby we work with teachers and other instructors across the country, but also across Africa, to create the content which are relevant to their users. So the content development process is very important, because the most of the schools in the African e-learning platform has no content for to provide to these users.
Excellent, excellent. Okay, thank you.
Thanks.
All right, and now we're going to go on to our 4th contestant, which is Mary from Calibra, Africa.
Okay, so I'd like to share my screen now. Okay. Giving work, getting work, developing together is what we do at Colibri. My name is Mary Abiodun, and I am the co-founder at Colibri. Our company, Colibri, is a crowdsourcing platform that helps businesses that have been in operation for over 1 year to outsource their digital tasks and projects, and they get the assurance of getting high-quality work within quick turnaround time. The Colibri team is an all-female team, with Fatou Dubia, Lady Gijo, and myself having a combined 12 years of experience in project management, software development, and community building. As women who are passionate about solving the problem of unemployment in Africa, we believe that we've got all it takes to succeed on this path. Now, what's the problem? 43% of businesses lose efficiency and competitiveness, and they spend too much time and money on digital projects, leading to high operating costs and lack of innovation. Again, companies lose as much as $1.8 trillion on different types of repeated tasks on a yearly basis, and they incur an extra 77% on costs for digital projects that are not outsourced. Our solution is a crowdsourcing platform which assigns outsourced digital tasks from companies who want to increase their in-house productivity to young Africans who want to increase their earning potential. Now, the uniqueness of our platform is that it is a crowdsourcing platform so that youth can come together to collaborate and deliver quality projects to companies. And we also have a review system where our reviewers review this job before they are delivered. And we do this so that we can drive social impact and help youth to increase their earning potential and develop skills while doing this. For a start, our target audience are e-commerce and marketplace companies, R&D companies, online entrepreneurs, international organizations, insurance companies, and marketing organizations. We know that these companies have repeated tasks to handle on a daily basis, and we would like to present them our solution so that they can increase their in-house productivity and increase their innovation. Now, when they do this, they get to improve their in-house productivity, reduce their operating costs, get their tasks within quick turnaround time, get quality work, get full customer support, and also discounted offers. Now, within 3 months of operation, we have made a revenue of $1,004, working with 9 businesses across Ghana, Nigeria, and USA, and we've also worked on 18 projects so far. Our revenue projection within the first year of operation is $360,000, which is expected to go to $6 million in the fifth year. Now, the reason for $6 million in the fifth year is because we would have expanded to other African countries, starting with the French-speaking countries like Cote d'Ivoire, and thereafter East Africa, starting with Kenya over there. And this is the cost of our financials. At Colibri, we charge a 20% commission on all projects and tasks that are undertaken, and we give this to young Africans who are willing to increase their earning potentials. We are looking to raise $100,000, of which 40% will go into marketing and developing the Colibri's brand. 35% will go into developing the crowdsourcing platform where youth can collaborate to take on our source tasks from companies and also to develop the tech infrastructure that goes along with it. And 25% will be used to cater for the Colibri's operations. Colibri is targeted at sustainable development goals 1, 8, and 10, which are decent work and economic growth, reduce poverty, and reduce inequality. Our youth workers are African youth from all over Africa, and they are tech savvy. They have the drive and the passion of the hummingbird, and they inspire us greatly. And because of them, we at Colibri, we are committed to giving work, getting work, developing together. Thank you.
Thanks, Mary. And now I'm going to listen to Victor from MediPal Healthcare.
Hi, everyone. So I'll share my screen now. So my name is Victor Omame, and I lead the team at MediPal Healthcare. 6 years ago, I nearly lost my life to the cold ends of death as a result of many challenges facing Nigeria's health sector. I was in the university, and I could not get access to my medical records. The number of students waiting to get attended to were over 100. And looking at that, I had to resort to self-medication. After that, I said if I could survive that ailment at the time, I was going to prefer a solution to this menace that's beheld this country and Africa at large. That's why I started MediPal Healthcare. I did a needs assessment analysis, and I discovered that the use of manual-based records across hospitals has slowed down patient engagement and has made several patients resort to self-medication. And also as a result of the high operational costs in most of these hospitals, we are looking to solve this challenge and also solve part of the challenges of the lack of unified record system in these hospitals. We discover in Nigeria today that a patient could have as many records in different hospitals at a time, and all of these records do not tally. This is one of those challenges that we want to solve at MediPal Healthcare. Doing that, we created hospital management software that would help these hospitals to automate their processes, scale up their practices while helping patients get access to medical doctors in few clicks. This is going to reduce the level of queues and ensure that productivity is maximized across these hospitals in Nigeria and Africa. Part of what our product does is the electronic health records that stores it up in the cloud. We also have the hospital and patient model. We have the blood bank model. We have the pharmacy model. We have accounting model. We have the human resource model. We have the laboratory model, and also data analytics, which is very key in getting the exact state of the healthcare in Nigeria and Africa. Part of our product extension is to build Africa's first e-commerce store for health sector, something like Amazon for health in Nigeria and Africa. So what this will do is chat and video call and consultations. We'll do search for medical professionals, appointment scheduling, home treatment services. We would also be able to link other health tech products and through APIs, link them in one solution, because everyone is having apps today and it's making it difficult for patients to get access to the right services. Our target market for the EMR solution, we're looking at 10% market share out of a total addressable market of $3.7 million. Today in Nigeria, we have, as of 2005, from the Federal Ministry of Health, which is the last time that the census was done, we discovered that we have 23,640 public and private hospitals, and about just 8% of these hospitals are currently digitalized. We also have 174 university health centers in Nigeria, and surprisingly, just one of these university health centers has a digital system. Our go-to-market strategy is to run physical marketing campaigns, partnerships with hospital associations such as the Nigerian Medical Association. We have online marketing strategy, and we have the associate marketing, which is referrals. So through one hospital, we're able to get linked to a number of other hospitals across board. Our revenue model is simple and seamless. It's simply billing every patient $2.62 USD annually. This is in the Nigerian Naira, 1,000 Naira every year. So this is pretty affordable compared to other EMR or hospital management services in the market. Our traction over the past few months, we've gathered 20 hospitals with over 50,000 patients. 20,000 patients have been treated in our pilot hospitals. We've been able to successfully raise about $39,164,000, and we've generated about $4,000 in revenue. We've been funded by the Netherlands consulates through the Orange Corners program and also the Bulb Africa. Our competitive advantage compared to some of the topmost EMR services in Nigeria, we have a robust EMR system. We have swift and professional customer success team because our billing system is a pay-as-you-go model. And our revenue model suits both small and big hospitals because it's quite cheap and affordable to everyone that goes to the hospital. Zero onboarding costs. Hospitals do not need to pay to come on board. And we have both the online and offline access due to the network challenges faced in Nigeria. Our projections, so we're looking at a total of 20 hospitals this year, $10,000, 2020, 2021, we're looking at about 120 hospitals. We already started expansion to other regions in Nigeria, and we're looking to expand to other countries across West Africa before we scale across board the whole continent. Then for that, we're looking at $164,000. In 2022, we're looking at 264 hospitals to generate about $372,000. We are asking for $250,000 to help with our physical marketing campaigns, expansion opportunities to reach the government hospitals and university health centers across board. And we're working on the telehealth and e-commerce platform, which is our product extension. And we are looking forward to having product enhancements and upgrades. Our team, we currently have an advisor, Dr. Kudus, who has helped us with building the system so far. I currently am the CEO of this company, and I have business development and project management experience. I have a CTO, Ife Damola, who has 10 years experience in full stack development. I have Osho as my COO, and Fowetomi as head of finance, and Michael as head branding and communications. Our impact over time, we target sustainable development goals 3, which is good health and well-being, and we've been able to successfully reduce mortality rates. We've increased access to healthcare professionals because we've made services in these hospitals a lot more swift and faster, and we've improved hospital service delivery. We've trained several women on how to use laptops and gadgets so as to be able to attend to patients in these hospitals. And across all these hospitals, we've successfully reduced massively the use of papers in Nigeria. We look forward to generating about $1 million at some point in 7 years after reaching out to 6,000 hospitals across Africa. We believe that you can be about a part of our journey in revolutionizing healthcare in Africa at large. Thank you.
Excellent. Thank you so much, Victor. Wow, so much going on. Okay, great. So listen, we've got a couple of minutes left for questions. So judges, if you've got any questions for Mary and Victor, now's the time.
Yeah, maybe I have one for you, Victor. I think that there are quite a number of companies doing hospital software. What is your unique advantage over competition?
Yes. So most of the companies that currently run the hospital management system, they have a one-off billing system of which they also bill subscription every year. These costs are they are too expensive for hospitals in Nigeria to bear, especially the medium-sized and the smaller hospitals. And what we are doing is we do not offer onboarding costs, meaning hospitals can come on board at zero cost, and their patients has to pay for the services as against the hospital's paying. So what we do is when a patient comes first time in a year, they are extra billed $2.6, and all through that year, they are not extra billed till the next year. So what we work is new patient registrations as against other hospital management software in the ecosystem. Of course, we also have great customer support services. We run monitoring and evaluation every month. And some of the hospitals who we got from different hospitals that are currently using EMR services, you will discover that most of these EMR companies do not give adequate support to these hospitals. And that is one thing that we have leveraged on and we've been able to gather about. Currently, we have 20 hospitals, and this is just in the past 4 months. And this shows that our model works compared to what is working in the market. So zero onboarding cost, great customer support, and great access to medical practitioners on the parts of patients. We've got patients referring us to several hospitals across board because of the great work that we are doing here in Nigeria.
Excellent, thank you.
Thanks.
Can I just ask a follow-on question on that one? Can you, Victor, please speak to the extra billing dynamic that you described? So I'm a patient and I guess I see value in the service, but how does it work? You've marketed the service to the hospital. There's no onboarding costs for the hospital. I walk in as a patient and I pay for the fact that that doctor can access my previous medical records effectively. Is that how it works? Or talk me through the
It works. Thank you very much for the question, ma'am. It works in 2 ways. Usually hospitals determine which model they work with. Our system offers the package where they can extra bill, and our system also offers the package where the hospitals pay us the consultation fees. Consultation fees in most of these hospitals go for about 2,000 naira. So most of the hospitals prefer to pay 1,000 naira off the consultation fee for the first time they come into the hospital in the year. Subsequently, the hospital owns the entire billing, the entire funds that are paid by the patients. However, some hospitals who run discounts for their patients, we have hospitals in different areas, they usually tell us, okay, can you extra bill? Of course, if it works for them, they're able to do that. And sometimes they have to split the extra billing system so that it doesn't make it too bulky for the patients to pay.
Okay, thank you.
Thank you very much, ma'am.
Excellent. Do we have any more questions from the judges for Mary and Victor? Okay, if there are no more questions, the judges will now start to deliberate, and we will come back shortly with an announcement on who the first place, second place, and third place winners will be.
Well done.
All right. Contestants, how do you think it went? Initial reactions?
I'm always glad.
Oh, hi.
Hey guys. I've got a
first with my list if you like.
yeah. Sorry guys, and I've got a 4:15 panel that I got to jump on.
Go for it, Stephen. You go first.
But I haven't actually compiled it yet, so I was going to say I'm going to jump out, but I'm just going to go ahead first.
So my top 3 are ERA, Smart Core, and then Scrap Pays in that order.
Okay, I was Smart Core, Scrap A's, and ERA in that order.
I had the same order as Ash.
Come on, Tam, it's up to you.
I have ERA as first, Scrap Pay second, and third is Smart Core.
Okay, so we know the three winners, and you guys have all gone ERA. The only problem I had with ERA was her ask was 30,000, which I thought, you know, dramatically hurt the business. So
yeah, she could raise a lot more money, I imagine.
Yeah.
Yeah, and it's not going to do her. I mean, what is she going to dilute on 30,000? And so, but she can, that certainly shouldn't hold her back, and certainly shouldn't hold my vote back either. So I'm fine with. I mean, it sounds like if three of us went
at number 2 though, right, with SmartCore and ScrapBase.
So, and SmartCore was my second choice. So if three of us have gone ERA, SmartCore, and ScrapBase, Tam, you okay to give SmartCore a second?
Yeah, that's fine. Yeah.
Yeah,
yeah, this is fine, I guess.
Cool. So I think we're sorted then.
Awesome.
Good by me.
Could you guys just announce that one more time, and then I'll let Angela know so she can announce to the group when we bring them all back.
Cool. Yeah. So I think we agreed ERA first, SmartCore second, ScrapBase third. And just for tech support, I'll probably drop out at 10 past just so I can go over to another Zoom link.
Sounds good. I'm going to bring everyone back now, and Angela can announce the winners to everybody from the pitch competition.
Thanks.
All right, we're back in the main session. Okay. So the judges, have you guys all submitted your responses? All right. Okay. Okay. So now we will hear from the judges who is in our third place position. So over to the judges for an announcement on the third place winner.
Okay, I'll do
before announcing.
Go for it, Tamim.
Sorry, no, so I just wanted to thank you all five for participating and for great pitches first. I think it was great to hear about what you're doing, and again, congratulations on making it up to here. And now I'll leave it to Ash to announce the third place.
Thank you, Tamim. I really appreciate that. And yeah, again, congratulations to everyone involved. Number 3, we thought the number 3 presentation was ScrapBase. So congratulations there.
Thank you very much.
Yay.
Good job.
Good job, good job. And the second place winner, which judge would like to announce that one?
I'll go ahead and do that. So again, congrats to everybody. Thanks for the good pitches. We felt the number 2 winner was SmartCore Enterprise.
Excellent, excellent. Well done, SmartCore. Okay. And for the number 1 spot and the winner of our 2020 Best Africa Pitch Competition, which judge would like to announce the winner?
I can. We felt that was Emergency Response Africa. So congratulations, Falake and team. I think you did like representing, but also we all agreed that there's so much value in what we're building, and I can't wait to track your progress with ERA. So congratulations.
Thank you.
Excellent, excellent. Those are our winners. So first place is Emergency Response, Falake's team. Second place is SmartCore, which is George's presentation. And third place is ScrapBase, which is Tope. So congratulations to our.
Thanks, guys.
Thank you, everybody.
Thank you all.
Thanks, everyone. Congrats.
Congrats, everyone.
Bye.
All right, cheers. Bye.